My fellow Akwa Ibomites, I bring you greetings and urge that we continue to stand in faith in the face of the global pandemic, which has shaken the world to its foundations. You may have read a rash of mischievous information peddled by certain media platforms on the status of the coronavirus in our state. I want to assure the public that the rumors and false information going around on social media are completely false. For emphasis, let me state here unequivocally that there is no confirmed case of COVID-19 disease in Akwa Ibom State as I speak to you now. As a matter of fact, the measures put in place, even at our airport, is comprehensive and has no parallel anywhere in West Africa. In our usual proactive stance, I had weeks ago given the Honorable Commissioner for Health, Dr. Dominic Okbo, the marching order to be on top of the issue, and an infectious disease prevention and control task force was immediately set up. This was even before the first confirmed case of coronavirus in Nigeria was recorded. Some of the actions initiated include: 1. Creating awareness, through the media, both print and electronic jingles, to sensitize the residents with relevant information on COVID-19 infection. And these are ongoing in the state in English, Pidgin, and local dialects. B. Sensitization and awareness campaigns have been taken to nooks and crannies of this state, notably local government offices, traditional institutions, religious bodies, educational institutions, public and private hospitals. 2. Surveillance, prevention, and infection control measures have been instituted in our hospitals. Personal protective equipment have been distributed to all health facilities to facilitate infection prevention and control. B. Other screening and infection materials have been procured and are being distributed to health facilities and other strategic locations in the state. These include infrared thermometers, hand sanitizers, etc. 3. Screening has been instituted at various entry points to the state. Training and intensive enlightenment awareness seminar sessions were also conducted in these areas. Functional ambulances and rapid response teams are on standby to move suspected or confirmed cases, if any, to the Emergency Operation Center at Ikorekbene. The Emergency Operation and Treatment Center in Ikorekbene is ready to serve as an isolation and treatment center to receive and care for any confirmed case of COVID-19 infection, if at all it occurs. We are also monitoring other entry points to the state. 4. The State Ministry of Health is in constant communication with National Center for Disease Control at the Directorate of Public Services have received sample collection kits from NCDC and are updating the management of the ministry on global, national, and state COVID-19 data and information on daily basis. However, I want to advise that we should all continue to observe the simple rules of personal and respiratory hygiene. Regular hand washing with soap under running water. B. Use of hand sanitizer where there is no water. 3. Coughing and sneezing into a disposable tissue paper or the cuff of the elbow where no tissue is available, and proper disposal of the used tissue. D. Put on a mask if you cannot properly move away from any person with those symptoms, and or give the person a mask to wear. It is also important to observe social distancing, avoid handshaking, and keep at least a feet away from anyone who is sneezing or coughing. I would like to remind you of some symptoms of the infection, which include fever, cough, sore throat, difficulty in breathing, generally feeling unwell, common cold like catarrh or runny nose, sneezing, cough. Anyone with these symptoms should self-isolate and invite our emergency response team for assessment and follow-up. We encourage you to report members of your family or friends with these symptoms to the Ministry of Health. Your report will be held and treated with absolute confidentiality. The Ministry of Health has already provided the emergency telephone numbers for you to contact the state's emergency team at any time of the day. Finally, I want to appeal to our people, especially the gentlemen of the press, to exercise utmost caution and deep sense of rationality and reflection in the manner you report this global pandemic. There's no redeeming value in causing panic in the state. There's nothing to be gained by misinforming the public. This disease has no political coloration. It does not and will not spare those to be infected along political lines. Therefore, we should put aside our political affiliations and tackle this issue as an existential threat. Given the measures aforementioned, it is our belief that there is no need to panic. Public schools are supposed to close in a week's time. I urge you to go about your normal duties. Thank you and God bless you.